Hello, friends. Hi. I wanted to talk to you about a condition that psychiatrists often come across. It's called akathisia, and the word is interesting. It means an inability to stand still, and this expression has been around for a while. It was used by a Hungarian neurologist, I believe, to describe a state of continuous restlessness and agitation that he observed in some patients that were schizophrenic. So the state of akathisia is in part a component of the psychotic spectrum illnesses. However, it can be improved, the symptoms can be alleviated. The most common cause nowadays for akathisia is the prescription of antipsychotic medication that have a dopamine receptor blocking action. These would be the more potent antipsychotics like Haldol, Prolixin, Stelazine, Nivane, and the higher doses of the newer atypical agent called Risperdal. And so what happens is that the patient, you're treating the patient for delusions, agitation, impulsivity, aggression, and so you're treating him and or her, and the patient gets better and then develops this sense of restlessness and pacing, and the nurses may tell you that this patient seems to be unable to sit still or relaxed and is constantly pacing. And as you observe them, you will see them, you may even see them shuffling in place, moving their legs in place. So this is to kind of underscore the driven quality of this symptom and side effect. So the treatment is important, and let's just go over why it's important. It's important because the patient themselves may not realize it, like why they're restless and antsy, and they may get irritable, and people around them may get irritable, and what can happen is that the psychiatrist or the nursing staff misinterprets this as an exacerbation of the underlying illness, the underlying psychosis and delusional state, and they feel like the behaviors are stemming from that illness. So naturally, that may lead to a prescription of even a larger amount of the agent that's causing the symptom in the first place. So it's very important for the clinician, a psychiatric clinician, to be aware of the symptom, know how to recognize it, and know when to treat it and not make it worse by overprescription of the very agent that may be causing it. So the agents that can be used to treat this are as follows. Cogentin, will work, 1 milligram twice a day, depending on the patient and their build and their age. You don't want to give too much cogentin, to the elderly, but for someone that's young and is having this EPS and akathisia, you can start with 1 milligram twice a day and then titrate it up or down, depending on benefit and side effect. Inderal, propranolol, is another agent that's very effective for the treatment of akathisia. In fact, the patient describe having, they feel the benefit, and they tell you that it's helpful. You can start with a low dose, like a 10 milligram twice a day or 2 3 times a day, and observe, for any side effects. The main thing that you have to worry about is dizziness, orthostatic hypotension. Be especially careful if there are already prescribed low potency agents such as Thorazine, because they cause alpha blockade, and the two, alpha and beta blockade, can lead to significant problems with hypotension, orthostatic hypotension, which manifests, of course, as dizziness upon arising, because the alpha receptors have opened up the blood vessels and blood pools in the legs, and decreased cardiac output, fall in blood pressure, dizziness. That's what you want to avoid. But you start at a low dose, and you shouldn't have a problem. But do look at the other medications that they're on. In addition to the Inderal or propranolol, there are other medications. Ativan, 1 milligram once or twice a day may be used to calm the acutely agitated person. And then you don't want to keep them on the Ativan or lorazepam or any benzodiazepine for a long time if you can help it, because of the addictive nature of benzodiazepines. But those three, they will work. You can use them not all at once, but in succession perhaps. If you really need to calm the agitated person, lorazepam can be helpful. Inderal usually works, and they notice the benefit in the first day. So, and once they're on it, make sure they stay on it, and tell them that it's an important part of their treatment. Because if you can make the person comfortable with their medication regimen, they'll be more likely to stick with the medications and continue to stay better and continue to stay in remission. The best psychiatrists that I know educate the patients. They tell them, what to expect, and they will allay and alleviate their anxiety that way, and gain compliance, gain trust. So anyhow, that's a little bit about akathisia. Be safe.